Workup. What does the transplant evaluation day look like? Well, on the transplant evaluation day, you'll arrive at the transplant center and begin registration early in the morning, about 8 a.m. or so. Then you'll receive education about the transplant process from the members of the team from 9 to 12. And then you'll be given a 45-minute lunch break, and then the afternoon evaluations will begin.
Who will I see on the evaluation day? On your evaluation day, you will meet individually with your transplant surgeon, transplant nurse coordinator, social worker, a pharmacist, the financial coordinator, and dietitian.
Workup. What happens after evaluation day? After your evaluation day, the transplant team will meet to discuss your case and determine whether you are a candidate for transplant at this time. If you are approved, denied, or asked to complete additional tests, the transplant team will notify you.
What is the waiting list? The national waiting list includes all patients who are waiting for any type of organ transplant. This list is done through the United Network of Organ Sharing. For patients on dialysis, their waiting time starts on the day they started dialysis. What is a patient selection committee? A patient selection committee meets about once a week. In this meeting, the entire multidisciplinary team reviews each patient that has been through our multidisciplinary evaluation day, and the team then decides which patients are ready to be listed for transplant.
How long does the transplant evaluation take? Well, after your initial evaluation with the transplant team, it may take a few months to complete any additional tests that may be required of you. You may also have other health issues that are not related to kidney disease and that will need to be addressed before the transplant in order for you to have a successful kidney transplant or a kidney pancreas transplant. It's important to stay in contact with your transplant coordinator and the staff here at the transplant center and follow the advice.
During the workup, who pays for the cost of a transplant? Transplant costs should be covered by your health insurance coverage. The type of coverage and benefits you will have determine your out-of-pocket cost. Medicare can be available to most patients with end-stage renal disease and can help with reducing the cost of transplant. Will Medicare pay for my anti-rejection medications? If you have Medicare at the time of transplant and the transplant is performed at a Medicare-certified transplant facility, anti-rejection medication will be covered by Medicare Part B for 36 months after transplant. If you are over the age of 65 at transplant or turn 65 within those 36 months, then Medicare coverage will not end.
Who can help me plan a proper diet throughout the transplant process? The dietitian at the Comprehensive Transplant Center can help you make healthy food choices and find an eating plan that works for you and your situation. Call the Transplant Center to schedule an appointment.
What happens after I've been placed on the transplant wait list? You will receive credit for the months or years that you have been on dialysis. You will be eligible to receive offers from the pool of deceased donors, and you will continue to see your transplant team regularly, and we will help you to keep your testing up to date. You'll need to continue to follow up with your primary care provider and any other specialists or other healthcare providers that manage your care. The tests that you need to update with those providers will regularly be discussed with you. They are individualized based on factors such as your age, gender, medical history, and etc.
How can I stay healthy while I wait for a transplant? There are many things that you can do to stay healthy while you are waiting for a transplant. Here are some of the most important ones. Eat a balanced diet with fruits, vegetables, grains, protein, and dairy. If you have chronic kidney disease, you will need to limit foods rich in potassium and phosphorus. Achieve and maintain a healthy body weight. Manage your blood sugar levels if you have diabetes. monitor how much sodium you're eating to help lower blood pressure and fluid retention?
What if there are changes in my caregiver plan? If there are any changes to your caregiver plan, including a change of phone number, a change of caregiver, a change of address, you must let your transplant social worker know. This way, the social worker can ensure that you will be properly taken care of both before and after transplant, and that your social worker will know who to contact.
My transplant coordinator just called and said there is an organ available to me. What happens next? Once the team knows the approximate time that the organ will arrive to the hospital, we will instruct you to stop eating or drinking and tell you and your caregiver when you should arrive to the hospital and where to go once you are at the hospital and what you need to bring.
What will happen when you arrive at the hospital the day of your transplant? Depending on the day, once you arrive at the hospital, you'll be directed to the admissions or the ER department, and then the preoperative area. You'll also have some additional testing done, which includes various types of blood work, EKG, chest x-ray. And in some cases, you may even require more dialysis just prior to your transplant. Your transplant surgeon will then come and meet you and your family members and review the surgery again. How long does a transplant typically take? A kidney transplant generally takes 2 to 3 hours, but if you're getting a kidney and a pancreas transplant, it'll likely take up to 4 to 6 hours. How painful is the surgery? After you wake up from transplant, you may have some post-operative pain. Your nurses and transplant physicians will do their best to manage the pain that you'll be having. They'll give you pain medications to control this.
Patients sometimes ask, where does the new kidney go in my body? And in general, we make an incision on the right side or the left side of your abdomen, like lower down here, and we dissect down inside and hook the kidney to the vessels going to your legs and behind the muscle layer. Another common question I have is that what happened with my old kidneys? And in fact, for the vast majority, the old kidneys stay in their place. We don't remove them. It's a whole different operation with some risks that we don't have to take the kidneys out. However, if they end up staying, we have to do an ultrasound probably every 5 years to make sure that there is no tumors that can develop in your own kidneys. So how things happen after the anesthesiology put you to sleep, we can make the incision on the right side or the left side. We dissect the artery and the vein that takes the blood down to your leg, and we hook the artery and the vein from the kidney to your vessels, so the kidney gets new blood supply. And then the kidney makes urine, and the urine comes out through a tube called the ureter, and we hook the ureter to your bladder area, and so that you're able to make urine normally like before. We sometimes put a stent, which is a plastic tube that can get to be removed by cystoscopy, which is a small procedure, probably 6 weeks or so after surgery.
What are the emotional risks of a transplant? The transplant process can be very draining for you and your family. Some people experience symptoms of depression, anxiety, survivor's guilt, and even post-traumatic stress after their transplant. These feelings are completely normal, and it is important that you communicate with your family and your transplant team should they intensify at any point during your transplant process.
Are there any programs available to provide financial support for transplant recipients? Each transplant case is unique. There are some patients that may have insurance benefits that cover transportation, others that may not. There are prescription assistance programs that are based on the patient's income. It is best to discuss the need for financial assistance with your transplant financial coordinator to determine what is available to you.
What can I expect when I wake up after my transplant? When you wake up after transplant, you will have a tube in the nose, to drain your stomach, and you will also have a catheter inserted in your bladder to drain urine. Typically, the tube in your nose is removed within 1 to 2 days, and the catheter in your bladder is removed within 3 to 4.
What will my scar look like? For a pancreas and kidney transplant, your scar will be about 8 to 10 inches from below your chest to right above your pubic bone. For a kidney transplant only, your scar will be about 5 to 6 inches on the lower right or left part of your abdomen. What are some of the possible complications after transplant? Following your transplant, there may be some complications that you suffer during your hospital stay. These might include 1. A clot in the pancreas or the kidney. This usually happens within the first 24 to 48 hours after the operation. 2. A break in the suture line of the bowel or bladder. 3. Delayed graft function. At times, your new kidney may not begin to function immediately, and you may need dialysis initially to assist the new kidney. 4. Urine leakage or hernia formation that will likely require surgical intervention. You'll carefully be monitored by your expert team of physicians to ensure that your new kidney or pancreas is ready before you're discharged.
Will I receive education prior to leaving the hospital? Prior to being discharged from the hospital, the team will make sure that you have all the information that you need to be able to care for yourself, your new kidney or pancreas when you go home. You and your caregiver will receive discharge education from the pharmacist, dietitian, social worker, and transplant coordinator. We will provide education-related anti-rejection medications, signs and symptoms of infection, rejection, wound care, when to contact your team, and how to record your vital signs, foods to avoid, and your lifestyle after transplant, as well as other important information. Your transplant team will be providing you and your caregiver with educational materials to take home and review. You will also have our contact information and instructions on how to get a hold of your team after office hours and weekends.
How do I care for my kidney after transplant? One of the main goals after transplant is to ensure your kidney is working well and that you are on the correct dosage of medications. Therefore, it is very important that you keep your appointments and have your lab work done as instructed by your team. You need to take all the medications ordered by your transplant team, and this includes taking the correct medication, the correct dose, the right time, and follow any specific instructions related to each drug. You will need to check your temperature, your blood pressure, wound, and measure the urine output. You will need to report any abnormal findings to your transplant team immediately. What does the first week after transplant look like? You may experience pain from surgery and feel overwhelmed with the information provided and new medications that you will need to take. During that first week, you will be getting used to schedule for taking your medications. You will return to the clinic about 2 to 3 days after being discharged. You will have questions and your team will be ready to answer those for you. Do I still need to meet with the transplant team after my transplant? Yes, you will need to continue meeting with the transplant team regularly, especially for the first 90 days. You will have blood drawn prior to meeting with your transplant team so that we know you are taking the correct amount of anti-rejection medications and that your kidney is working well.
What medications do I take and how will I keep track of them? After a kidney or pancreas transplant, you will be taking medications to prevent rejection of your new organ and to fight infection. It is important that you take all of your medications as prescribed by your doctors. Preventing organ rejection and fighting infection is a delicate balance that requires close attention and care for the rest of your life. Medications that help prevent the body's immune system from damaging or rejecting the new organ are called immunosuppressants or anti-rejection drugs. After your transplant surgery, you will be prescribed a total of 3 types of anti-rejection drugs that may include tacrolimus, cyclosporin, prednisone, mycophenolate, or azathioprine. However, immunosuppressants also block the immune system from fighting real threats like viruses, bacteria, and fungi. You will be prescribed medications to help prevent infection after transplant, but generally these will only need to be taken for 3 to 6 months until your immune system is strong enough to defend itself against infection. After your transplant, you will be given clear instructions on when and how to take your medications. This information will be reviewed with you while you are in the hospital and each time you come to the clinic until you are comfortable with how and when to take your medications. How long will I need to take my medications? Typically, anti-rejection drugs must be taken for the rest of your life. Will my medication dosage decrease through time? The dosage of the medications you are taking will be customized to you and will likely be decreased over time, as determined by your doctors.
How often do I have to get my labs drawn after transplant? After discharge, you can expect to have your blood drawn once or twice a week, depending on how your kidney's working, your medication levels, and other parameters. The frequency of blood work decreases as time goes by, but please expect to have blood work every time you come to see your transplant team.
Yep. What happens if my transplant fails? Unfortunately, sometimes a new kidney transplant can stop working as well as it did at the beginning and eventually fail, leading you to need dialysis again. If this happens, you can still be a candidate for another transplant. This happens and people are able to undergo successful transplant again, often on the opposite side as before. They will end up having a total of 4 kidneys. If for some reason the first transplant starts to be painful or something happens, we occasionally have to remove it.
What happens when my Medicare terminates? If you anticipate you will be under the age of 65 at 36 months after transplant, you should have other insurance in place in order to prevent interruption in coverage of your anti-rejection medications. The most common option is having employer group health plan or being added to a spouse's plan. Always talk to your transplant financial coordinator for recommendations prior to termination of coverage.
Why do I need to practice food safety after transplant? The medications you take after transplant weaken the body's ability to fight infection. It is important that you protect yourself after transplant by making safe food choices and practicing safe food handling rules. What do I need to know regarding my diet immediately after transplant surgery? After surgery, your body will require extra calories and protein for wound healing. If you have a low appetite, try eating small, more frequent meals. Nutritional drinks and shakes can be helpful if you're not eating enough food. Your dietitian can help you find a supplement that you like if one is needed. Do I have to watch my diet after transplant? Yes, diet still plays a role after transplant. The medications that you take after transplant may increase your risk for excessive weight gain, heart disease, diabetes, and low bone mineral density. Following a heart-healthy diet can help reduce these risks. A heart-healthy diet is made of whole grains, fruits, vegetables, low-fat or fat-free dairy, and lean protein. It is also low in saturated fat, trans fat, and excess sodium and sugar. What are some foods to avoid after my transplant? Transplant patients should avoid raw or undercooked fish, poultry, meat, and eggs, unpasteurized milk and dairy products, food that is spoiled, moldy, or past its use-by date, grapefruit juice, and pomegranate juice. Herbal supplements, and uncooked sprouts, like bean and alfalfa sprouts.
Living donors. What are living donors transplants, and what are the benefits of living donation? Donation from a living donor can provide kidney patients with several benefits and are generally associated with better outcomes than a deceased donor. Oftentimes, the wait list for a kidney from a living donor is much shorter than a deceased donor kidney transplant. Once a patient has identified somebody who wants to donate a kidney to them, they shall be expedited and seen in the transplant center as soon as possible. And if a matching donor is found, the surgery can be scheduled at a time that works best for the two. And this means you get a transplant quicker and at your convenience. And also, you spend less time on dialysis and avoid potential health complications that come with the additive burden of dialysis. Additionally, transplants from living donors tend to last longer than from deceased donor kidney transplants. They last average of 15 to 20 years.
Who can donate a kidney to me? Anyone can be a living donor. While family members generally offer to donate their kidney to loved ones, a living donor may be anyone, from family, friends, neighbors, community members, and the list goes on. They do at least have to be 18 years or older and not have kidney disease. What do I do if I have a living donor? If you have a living donor, you can provide them with a phone number to the Comprehensive Transplant Center so they can get the process started. They will complete an intake and be connected with a living donor coordinator, who will inform them of the next steps. Does my potential living donor also have to get evaluated? Yes, all potential living donors have to go through an evaluation that involves medical and psychological workup to make sure that the donor wants to donate their kidney and that they are healthy enough to donate. This evaluation may take several months depending on the health of the donor and how quickly they are able to take the tests.
What happens if we don't match? Well, sometimes potential donors aren't a good match with the patient they want to donate to. This is often due to incompatible blood types or what we call a cross match. This happens not too infrequently, and the living donor can still help the patient if they want to donate the kidney to get a living donor transplant. For this to happen, they would have to participate in what we call a paired exchange or a donor chain. Paired exchange is where two kidney patients have healthy donors who aren't good matches for their respective recipients, but they are compatible with the other donors, other recipients, and then they can swap. And these donor chains are becoming fairly common and help several kidney transplant patients get a possible living donor transplant. The outcomes often are the best possible with these. Oftentimes they are started by non-directed donors or donor who wants to help kidney patients by donating to someone they do not know. Can a potential living donor stop the evaluation of a kidney donation? Yes. A potential living donor can stop the evaluation at any given point in time and can decide not to donate even on the day the surgery is scheduled. It is completely up to them.
People sometimes ask, what are the risks of living donation? Donors may have some short-term problems after surgery. You can imagine after an operation, some bloating, feeling sick to their stomach, obviously a scar, pain from the incision site, feeling tired and weak. However, sometimes more serious problems can occur. This is certainly not common, and the surgical team does everything they can to make sure that these don't happen. But some of the serious problems that can occur would be something like confusion from after surgery, pneumonia, very rare, something like a stroke, heart attack, or infection, fever, bleeding, or blood clots.
Can living donors still have children after they donate? Yes, both men and women can donate and still have children. Women should wait after donating before getting pregnant such that their bodies completely heal before they embark on getting pregnant.
What does recovery look like for a living donor? Typically, donors stay in the hospital for a couple of days till they are cleared by the transplant team for discharge.